Welcome back to the program and good morning KSA once again. We hope you enjoyed our time to focus there. But today our main segment is going to be, or our main topic of today is going to be about facelifting with threads, which is a relatively new technique or new to our society. And we are joined by a very special guest to tell us more about this procedure and how you at home, if you would like to eliminate some of the years from your face, and also I've come to know from different parts of your body. Allow me to welcome Dr.Mohammed Alnasir, who's a plastic surgery consultant. Good morning, Dr. Mohammed, and thank you for joining us.
Good morning, thank you.
Just to clarify to the viewers, if anybody's watching us at home and they are thinking of a new way that they could eliminate the years or make them look younger and more beautiful, what initially is facelifting through threading?
It's quite a new technique which started in the late 90s, and it has become very common in the last 2-3 years. And the idea is it's relying on the concept of using special kind of threads, which is made of special materials like silicone and polyethylene. So the thing is, we are gonna tighten the skin and the subcutaneous tissue by using special kind of threads in a specific location in the subcutaneous tissue.
And Dr. Mohammed, you've told me and Diana that this process is not just for the face, but it's for other parts of the body. I mean, where else can we use this procedure?
We can use it to lift the neck. We can use it to lift the breast, but we have to be careful. Not all the cases of breast ptosis or breast redundancy we can treat it with threads. It's only the very mild ptosis or redundancy of the breast going to be treated with this technique. Because as you know that the breast is being subjected to the effect of gravity. So the more volume you have in the breast, the more it's going to be subjected to the effect of gravity.
Absolutely.
So you cannot counteract the effect of gravity by using threads. So you have to use a surgical procedure to
maybe for instance, let's say postnatally, if after breastfeeding and so on, maybe somebody wants to tighten this area, or through weight loss, is this maybe some of the circumstances?
Post-weight loss, yeah.
That's interesting. And so this is basically a relatively new method, but how effective is it so far?
Yeah, that's a good question. It's actually, it can give you a 3 to 5 years of good results.
Okay, that's
afterwards, you're gonna have skin redundancy. So it's not a long-term result or something like that. We can use it in patients after the age of 30.
Okay.
And up to 60 years.
So Diana, we're still far away from that.
We still have got good years ahead of us.
So the thing that's after 60, I mean, the effect of surgery is going to be great. So you can use it for patients who are older than 60, but it won't give excellent result. So for patients older than 60, it's better to do operations.
That's very interesting. And so, I mean, so far, could you give us an idea? For example, we understand that this method is done by using threads.
Yeah.
Can you give us, let's say, a few other differences that would differentiate it from the olden method?
Yeah, actually, the old technique is it involves a surgical incision, which passes in front of the ears and behind the ears. Okay, and you can just extend it up to the neck according to which area you are treating. You know.
Oh wow.
In the past, we used to do transcoronal incision through the skull if you want to lift the forehead. Right now, we are not doing it. We just do Botox to lift this area. So. People are looking for a less invasive kind of procedure. They are not willing to undergo more complex operative procedures, and the results are quite promising.
Wow. And speaking of the results, though, Dr. Mohammed, something that comes to mind, and maybe to a lot of the women who are interested in such a procedure, how many years can this knock off? I mean, if let's say a woman comes in to your practice and she looks, let's say, she's 60 or she's 50. Can you actually make her look 20 and 30? How?
Not to give her
I mean, what should somebody expect? Because we want people to have
realistic expectations. To give you 10 years younger look.
10 years younger.
10 years younger look.
It's still good. I mean, 10 years is a long time out of somebody's life.
10 years longer, it's worthwhile.
Oh wow!
And you said something. You mentioned something very important, that the procedure is not, let's say, permanent. It's more of for a couple of years and so on. So if somebody wants to get the 10 years back, do they have to go and get the procedure done again, let's say?
After 5 years of being done, it's being recommended to repeat the procedure once more, and it will still give you an excellent result. And there is no harm of repeating the procedure, actually.
It's not harmful at all.
Actually, I presented lately in the American Society plastic surgery, like an article about like the cases we did, and we are quite satisfied with the result that we obtained with patients.
That's good.
Like the short-term results are very satisfying.
That's very interesting. And so earlier you mentioned Botox. For example, I'm not sure, but does facelifting done with threading, does it have the same effect as Botox? If I'm not mistaken, that is?
So, like if you're gonna do like eyebrow lifting,
Okay.
okay, you can achieve that with Botox.
Okay.
You know, but sometimes you cannot achieve it with Botox, so we need some kind of mechanical force.
This is where facelifting
Like
comes in.
Botox, like a chemical.
Exactly.
And it's more of a filler as well, isn't it?
No, it's not filler. Probably it's a good thing that you've shed the light on this kind of thing, because like there is like a confusion among the people.
Botox and fillers.
There is what's different between a filler and Botox. Filler is from its name, to fill something. To fill something which lack the volume, so you're gonna fill it. While Botox is a completely different thing. Botox is like a toxin. And it's actually Botox. It's not like a generic name. It's a commercial name, because like it's being extracted from a special bacteria, which is the botulinum toxin.
Is it injected?
Yeah, it's injected. So it's like Botox. So botulinum toxin. So they've extracted Botox.
Okay.
But it's like it's a well-known American company, and we don't want to do like some kind of advertisement. But it's being known among the people as Botox. But in the market, there are like 4 or 5 other like different like
Names
Botox
with brands,
leading
but
brands.
it's not like as
That's
Botox.
interesting.
Like there are Dysport and other stuff.
That's
Wow.
interesting.
So just to clarify this, the effects are different from facelifting with threading and what you can get out of anything else.
Yeah, more or less. Yeah.
That's very great. And so you also said that as you said before, that this method used by threading can not only be done on the face, but can be done any part of the body. So far, sir, from your patients, or let's say with your patients' results, what part of the body is more common? I think maybe face would be...
Face, followed by the neck, because sometimes you see like ladies in the middle age, they would have like some redundancy in the neck, so they would benefit from like some lipoaspiration or liposuction combined with the lifting with threads, because like you can suck the fat out, but still you have the skin, which is redundant.
Exactly.
So you need to tighten the skin. So you need to use the thread.
This is very interesting, Dr. Mohammed, but something that comes to mind, and maybe especially when you mentioned the 10 years, which sounds great, everybody wants to be younger and more beautiful. Is it an ongoing process where you'd have to get more than one thing done? Because, for instance, as you mentioned, the neck, I mean, if somebody let's say, or does the face, and they leave the neck out, so then they still look older. One thing that really comes to mind and is very visual with people who have had such procedures is the hands, especially for women. And once they've done the neck and they've done other parts and they've done the face, and if they leave the hands out now, is this process suitable or available to be done on the hand? Because Diana, I don't know if you'd agree, but the hand is more visual, and you can definitely see the years on people's hands.
That's true.
Yeah, actually, I would like to congratulate you on this remarkable observation, because especially in the Arabic community, people would tend to have the scarf, okay, and so the face is being open, or being exposed, as well as the hand. So when they put, for example, a makeup, they will forget their hands. Where actually, like if a lady who looks like 50, you can look, but she wants with her makeup to show like she looks like as 40. You can tell from her hands, because she will forget to put makeup on her hands. So it's not a technique for the hand, but there are other techniques for hand rejuvenation, or rejuvenation de la main, utilizing like fillers, as you mentioned, utilizing fat. Now we are in the process of injecting fat in the hands.
Okay, and so this is like to pump the...
Yeah, to fill it.
Okay.
You don't have to have more volume. Like there is an American expression saying that bigger is better, which is not really true. It's the thing is just you have to show like how beauty the hand is without like exaggerating things.
Absolutely. I'm using my imagination. Just like, for instance, injecting fat so that you can tighten the skin. Tighten the skin by pulling,
It's actually
pumping.
as you're having an envelope which is empty. So you have to fill it. So as soon as you filling this envelope, as you're gonna fill it, it's gonna
To
be
pull the
like
skin.
it's gonna tighten up with time, you know. So we can inject fat and plasma, or PRP, which is like a new technique which is being based on the technology of stem cell transplantation, and which give like a longer survival of fat cells being transplanted.
That's
Which is
interesting.
like the last breakthrough in
That's
rejuvenation.
interesting. And so earlier you mentioned something very important. I really do hope most of our viewers are actually listening to this if you're planning to undergo any surgical procedures. But there's something very important. You said realistic expectations.
Yeah.
And I believe this is something very important regardless whatever change you're going through. Can you give us an idea? So how do you, let's say, talk with your patients beforehand? Just to give them an idea about how the procedure goes.
It would be very clear if we can show one video of the one I brought, so I can comment on it. So, like, if a lady comes with like with the wish of having like an eyebrow